Great. Welcome back to the program. Still Breakfast 247 live here on channel 247 TV. I told you earlier that I want to get into some festival and cultural dimension in terms of some conversation relating to that end. And I've been joined by Emmanuel Mbansi. He's ambassador for Accra Arts and Health Festival, and he's here to give us some light into what that is really about and how arts is really transforming the medical space. We'll get into that conversation. You can also join with your views and opinion across all of our social media platforms. Good to have you, Emmanuel. How are you?
Very well, thank you. How are you too?
Fantastic. I'm great. Now, talk to me. What is really the vision behind the Accra Arts and Health Festival? What is it about?
Thank you very much for having me. The Accra Arts and Health Festival is designed to position Ghana as a continental leader in creative health. So our vision is to show how arts, culture, and innovation can strengthen well-being, as well as transform health system in Ghana, as well as inspire community resilience. Because of course, this year's edition is designed to deepen community commitments by activating Accra Art District as a creative health corridor, which is something that is going to be, for the very first time, introduced in Ghana, right? And we're being hosted by the Knoxford University at East Legon and in partnership with the British Council in Accra.
I see. And so you're looking at using arts to transform the health space.
Yes.
Tell me much about that, especially in terms of the clinical space, what that seeks to do really.
Well, the conversation is essential because Ghana's future health workforce must be equipped with, first, the tools that go beyond traditional clinical boundaries, right? So, for example, the opening session at the University of Ghana Medical Center is designed to explore how creative practices are transforming clinical environments and medical education across Africa. First of all, we're going to do that by helping emerging leaders, young practitioners, health professionals, deepen empathy, enhance patient experience, and integrate arts into healthcare, right? You go to a health facility these days, because of pressure, maybe they are overwhelmed with their normal numbers for let's say for a day. Let's say they usually attend to 100 people, and all of a sudden there are 300 people. So where creative art comes in to ensure that we're able to create a system that could facilitate a swift attention to each patient that comes to them. And also, for example, I mentioned empathy, to be able to help them develop some empathy to understand the needs, to be patient with the patients, right? So these are what the art and health comes together to develop innovative ways to addressing health challenges in Ghana.
That means that it's important we infuse that into our academic or the university systems. Wouldn't you agree? How do we do that?
Yes, I believe creative practices can be embedded into medical and public health training in Ghana through storytelling, for example, movement-based learning, art-integrated workshops, and also ideation labs, right? Now, what this festival aims to achieve is to demonstrate that through our plenary sessions, our performances, and our creative health ideation lab, which we designed to equip students who are coming in, health practitioners, with actual practical tools, right? To be able to reimagine, re-innovate innovation, right? And as a matter of fact, break the limits, reimagine healing, right? And communication. Because it's one thing to be a health expert, and it's another, and be able to heal people, but it's another thing to have patience for them and walk them through the healing process. Listen, you've been diagnosed with this. But I can walk you through your healing process. And there's another one. Listen, this is a deadly disease. I'm not sure you're going to make it, but whatever. These are the medicine I'm prescribing XYZ stuff. So it's just the communication that could keep somebody up
Okay.
People say you don't die of the you don't die of the diseases or illness.
Okay.
You die based on how it was announced to you. You know, someone tells you you're going to die soon because you have this.
Yeah.
Another person walks you through it, communicates so well that you love even walking through the healing process. Yeah, so
I see. Now, I understand you have some partnership with some academic institutions now, but what long-term impact are we looking to achieve from those?
Right. So on the first day, we aim to sign an MOU with Knoxford University and the Global Arts and in Medicine Fellowship, which is a landmark step for us, right? Which, of course, underscores a long-term collaboration in research, professional training, and cross-continental innovation. And what we also aim to do, aside from signing an MOU with the Knoxford University, is to collaborate with the British Council, because they have quite a rich in terms of their impact in Ghana over the last 80 plus years since they've been here, to make sure that what we are doing, they are able to expand it. They are able to have a long-term impact, not just for Accra, but for Ghana as a whole, right? So collaborating with Knoxford University, the Global Art in Medicine Fellowship, as well as the British Council.
So it means that there is some sort of global partnerships as well. How is that able to impact the health ecosystem here in Ghana?
Yes, so when we have health professionals from around the world contributing to transforming health system in Ghana, I believe that's going to have a long-term consequences.
I see. So is it the case that they're going to be based here in Ghana, or they're going to be anywhere in the world and working? How is the work schedule going to be like?
Right. So for this program, we are hosting it in Accra.
Okay.
Now we have people coming from around the world. Ghanaians based in different parts of the world, which we call like a diaspora homecoming, if you like, where they will share best practices, they will get to educate, they will get to network with our people in Ghana here, and those who have come from around the world. So it's an opportunity to learn, it's an opportunity to impact, it's an opportunity to share what you have.
So this is a global initiative.
It is.
And that means that when we talk about the global space now, we're looking at technology, AI on the rise. How do you intend to infuse this in terms of making sure that you leverage the technology space to boosting what you're doing?
That's a very great question, actually. You know, technology is a powerful, powerful accelerator for creative health. Now, sessions on AI, which we have as part of this program, digital media, and health innovation, such as the presentation by AI Rethinking Africa, or Rethink Africa by John Ofori. It's designed to demonstrate how digital tools can expand access, support mental health, and strengthen public health messaging. Now, the roundtable which we have designed on creativity, digital media, nutrition, and inclusive public health will help further show how digital platform can actually make well-being more inclusive and community-driven. We have the likes of the, I believe, Need the dietitian. We have the likes of Nanama Dwamina, Diet with D. These are people coming in from different spheres of health, you know, to educate, to create awareness, to also get to share what they have been practicing over the last couple of years, some for 10 years, some for 2 decades, you know. So it is actually a great opportunity to introduce artificial intelligence in enhancing our health and well-being.
I see. We'll talk about the policy bit of it, but talk to me about the cultural heritage of Ghana and how that is supposed to also assist in what you're doing.
Ghana has become a hub for, I would say, the gateway, as you say, gateway to Africa. But for West Africa, Ghana was the first country out of the top 10 prominent nations in West Africa to have what I would call a diasporal homecoming, not just for Ghanaians abroad, but for any black.
Okay.
Right. That race, which was hosted a little bit after COVID by the His Excellency Nana Addo Dankwa Akufo-Addo. Now, that movement opened the gate for this kind of initiative, for us to be able to continue the impact that was already established a little bit after COVID, right? Now, the cross-sector collaboration that we are doing, which aims to bring in health professionals, AI experts, innovators, folks in the media, musicians, artists, people from different backgrounds to one room to create something that will further the impact, which has already begun many years ago in Ghana. So how would that help Ghana? I think that's the question. Yes, it will help in scaling impact. It will help in educating, contributing to the already established educational system to educate young people in health, in arts, and promote STEAM education, right? Science, technology, engineering, arts, and mathematics. So that is what we aim to do.
I see. But it means that there has to be some sort of policy shift.
Yes.
What are those? What are your expectations in terms of policy to help allow your initiative thrive here in Ghana?
Well, scaling creative health nationally requires investment in research.
Okay.
It requires community programs. It requires cultural infrastructures. And ultimately, it requires cross-sector partnerships. Now, the cross-sector dialogue, which we have as part of our program, explores investment pathways. It also explores policy frameworks and research evidence, as well as national strategies. Because recently there was a big national AI or STEM program that was launched by His Excellency the Honorable Sam George, right? Now, that's a big national strategy to impact or continue the lasting impact of AI and artificial and STEM education.
Okay.
But these national strategies are needed to be able to embed arts and health into Ghana's development agenda, which we know, of course, every 4 years we have a party that comes to power and wants to, continue the impact or set a new agenda. But this includes funding for creative health training in Ghana. It includes public facing programs and integration into national policies, which we believe this program, when we have all the people in one room speaking, sharing, networking, and growing, we'll be able to have a lasting impact.
You mentioned Ideation Lab. Tell me, what sort of ideas do you see emerging in the near future? You talked about Ideation Lab. First of all, what is it about? When you talk about Ideation Lab, what is that? Just before we end the segment.
Right. The Ideation Lab is actually designed to produce practical, community-focused prototypes.
Okay.
Right. And we expect ideas because, of course, when you have a room where some of our partners include STEMmate, who will be sharing, creating stuff real life in the Ideation Lab after an idea with young folks in the room, who, someone can be asked, can you tell us, share an impressive idea? Someone said, okay, I want to create something that could address a problem of, let's say, collecting debts in a space. And right there, they start to create something out of that. So how will it work? What kind of problem is it going to solve? What will we need to be able to address this? Imagine having 100 young folks currently, or 1,000 of them, thinking about how to solve a particular problem. We recently had flooding issue, and in Ghana. And how are we going to address that? Imagine it's one of the things that we could actually bring young people together to think about. Now, in the Ideation Lab, because of course the focus is on health and arts. So we expect ideas around mental health support. We expect ideas around youth engagement, healthy aging, climate resilience, of course, already I mentioned on flooding, digital well-being tools, and art-based public health communication. The lab is designed for design thinking. Okay. Right? To help our young people with critical thinking, analytical thinking, problem solving. It's also a way of enhancing their, essential life skills, hard skills, soft skills. When you enter a room where it's about solving problems,
okay,
why won't you innovate?
I see.
So it goes beyond just creative to executing things,
bringing action on
yes,
board, not just
yes,
the talk.
yes,
I see that. But just before we go, we should be wrapping up in a minute. Where is this? Talk to me about where it is happening again, and is it open? Anybody at all who wants to join can participate. How is it like? Talk to me about that.
Absolutely. It is happening from the 21st, actually from Monday the 20th, all through to Saturday the 26th of July. Now, one event, but different venues.
Okay.
From the University of Ghana Medical Center to Knoxford University on Tuesday, to the British Council on Friday. So the Friday at British Council start from 4 p.m. to 8 p.m., which is more centered on networking and dialogues.
Okay.
Right? And also we have an art exhibition as well. So we have quite a number of artists who will be exhibiting their amazing works, which is, available from that Friday all through to the Sunday. Now, that's 4 p.m. to 8 p.m. Now, for the Knoxford University, it starts from 10 all through to 3 in the afternoon. Participation is absolutely free, but we have limited slots available at the moment. So if you want to register, do visit www.accraartsandhealthfestival.com
www.accraartsandhealthfestival.com and get registered before the slots get finished.
Absolutely.
So the registration is open up until when? When is it closing?
It's open up until, Monday.
Monday's deadline.
Yes.
So you heard that, www.accraartsandhealthfestival.com is where you want to visit to register for your slot. It's limited if you want to be a part of this exciting and great innovative way of changing the health system. You don't want to miss that. So get there and get registered. My name is Isaac Etonomiji. I've been having a conversation. Thank you very much for being here. It's good to have you. Emmanuel Mbansi, he's ambassador for Accra Arts and Health Festival, speaking to us. There's a bye, and we'll see you again next week.